Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. All right, Donnie, tell me what's going on with your lower extremity. What happened?
About 6 years ago, I was placed in a boot that sort of restricted this movement for almost 6 months.
Why?
And
Why you had the boot? What happened?
a slight case of Achilles tendonitis.
So you had Achilles tendonitis. The prescription was using a boot for that. Okay.
And then
You said for 6 months.
6 months.
Okay.
So we never regained the range of motion back, and up until this point, I tried.
Let me see your range of motion. Okay, can you see it? Go down. Okay, let's compare it with this one. Okay. He's going further more up and down. Let's do the other one. Yeah, and very stiff. You can see the range of motion is very like slow, like.
The biggest thing is when this hits its peak.
Okay, how much pain
It's
there from
rigid.
0 to 10?
When you get to right there, its peak, it's screaming. It's probably a good 6.5, 7. Like right here, I'm at my peak, but if you was to grab it, you could get further.
Okay.
This right here, when it gets its peak,
You
it's
start to muscle spasm or sharp
spasm
pain.
or
Okay.
sharp knife pain
Okay.
or
You feel the sharp pain in the
Yeah, I
calf
feel
or
it
the
just-
whole thing?
right now I
How much
feel
from
it
0 to
right
10?
here. It's probably about 6.5, 7. I feel it right here, right in here, and right up through here.
Okay, so that was 6 years ago, and you had 6 months of wearing the boot. What other treatment you have?
Everything. Physical therapy,
Physical therapy,
acupuncture,
acupuncture,
massage,
Massage,
chiropractics,
chiropractic.
orthotics,
Orthotic.
AFOs, you name it,
Okay.
I've done it.
I'm sorry. Okay, so you did everything in the book.
Yeah.
Okay, so how much pain at worst from 0 to 10? And when I was interviewed before, you were saying after wearing the boot, you start to have issues everywhere else.
Yeah.
So can you describe like lower extremity? What else happened after wearing the boot for 6 months?
After
And that's very common, by the way. When you wear a boot, it's like your car out of alignment. So that's gonna cause leg length discrepancy. And if you wear it for a long time, that's gonna cause wear and tear on one side more than the other. Like when you have your car out of alignment, for example, in your case, your car out of alignment for 6 months. What do you expect? You're gonna wear a lot. We'll do a lot of wear everywhere in the lower extremity. If it's a shorter period of time of wearing the boot, it's not gonna be as aggressive. But the idea of wearing a boot for tendonitis for 6 months, it's kind of extreme approach.
Yeah.
Okay.
So on this leg, it's always the hip flexor, which when all of this happened, I never got regained function of this hip flexor. I'm locked up there.
Locked up there.
Every
Okay.
once in a while, I don't know why this does this, but I get my anterior tib
It's
goes into spasm.
compensation.
Yeah.
Because you're not contracting the correct muscles here. So you have to compensate.
Yeah.
So instead of your weight even 50-50, you decrease the weight on one side, you put it like 70-50, you just walk funny.
Yeah.
And that's why you start to have issues.
And this
everywhere.
posterior tib, I guess, is what causes this swelling. It's not too severe at
Okay.
times, but it just swells a little bit right
Okay.
there.
But the right side is the worst.
Oh,
That's
yeah.
when it started. So we're gonna focus on the right side. We're gonna work on both of them. I noticed when you came, you were using cane. Can you explain to me what's going on? Why you use it? Do you feel your balance off, or because of
Oh,
pain?
yeah,
What's going on?
Up until it took me I was on a walker. I was stuck at neutral
Okay.
and on a walker for over a year and a half
Okay.
after I got out of the boot.
Okay.
And then I had about 2.5 years to where I could walk and do things halfway normal, but I knew my walk was way, way off. I was compensating, and then about 6 months ago, I guess the compensation I was doing ended up getting my back, and I don't know if it's
So
my
you start to
SI
have back
joint or
pain.
what. Yeah, and I don't know if I got sciatica or what, but it.
Do you have
It-
back pain going down to your legs, or just localized in the back?
I don't know, because my leg hurts all the time. Now the back
So how much
hurts too.
constant pain from 0 to 10? 10 is emergency roll.
Probably 3 or 4 constant.
Constant pain. And when it gets at worse, how much from 0 to 10?
Probably 8.5.
Okay, so I will have you walk and you want to give me numbers. How much pain? Well, hold on. So you came with the cane.
And the cane slows me down.
Do you need to use it or can you walk
No, I
without
can
it?
walk without it.
Okay, so we'll have you walk in the whole way back and forth. Let me know how much pain from 0 to 10 and where do you feel it.
Okay.
So we'll walk this way. So I just gotta describe how you walk. You just know what you usually do. So your gait extremely slow, very stiff. You have really very wide base of support. How much pain and where do you feel it?
That wide is not normal to me. I just
Just to
sort of-
compensate.
When I come close in, this hip and right through here
Okay.
is extremely tight.
Well, I can see you really don't have a lot of ankle movement. Let's do go back and forth. Typically, especially the left and the right, you need to have some ankle movement to clear up your foot to do heel to walk, and that's a normal gait. I'm not seeing that. You just flat, your feet flat on the floor, landing. That's very typical with a lot of stiffness, and you can see the limping a little bit. How much pain now from 0 to 10?
Probably about a 5.
Where?
Right up through here
Okay.
and then right in here.
Okay. So we'll have you lie. Are you comfortable? Because you will say anterior tip, some anatomical landmark. So what's your background?
Dentistry.
Okay. So you had physical therapy, a lot of other stuff. Just ask, if you have any question, you can let me know. Okay.
Alright.
And I'm gonna explain a few things that will make sense to you, and I will try to simplify it for whoever watches the video. You feel this knot here?
Yeah.
Make sure it's pain-free, okay?
Yeah.
So I have a tool actually to go deep and work on deep scar tissue. This is what I'm using now, and deep fascia restriction. How does that feel?
Feels alright.
Okay. So I actually try to release the scar tissue and the deep fascia restrictions. Make sure it's pain-free, okay? How's that?
Feels alright.
If you feel pressure, that is okay. If you feel pain, it's not okay. You okay there?
Yeah, it's a little twingy, but I mean it's fine by me.
Okay. As long as you don't feel pain, that's fine, okay? You feel this bump here?
Mm-hmm.
That's a scar tissue. And anatomically, you should not have that hardening, that going back and forth like this. You feel that? Can you see it? You see my hand?
Mhm, I
Muscle.
see.
You don't have those knots in the muscle. Is it too much?
Yeah, that's good.
Okay. And the tightness more internal, medial, or lateral, or both?
It's usually always been more medial, but here recently it's gotten lateral. I think I'm rolling it over my ankle, and
It's gonna change because you're gonna change the compensation because
Exactly.
you are tired and that's painful in this side, so I'm gonna walk funny on the other side. It's just gonna be all over the place. That's why with this situation, it's gonna be like random, based on the compensation, and that's very typical after wearing the boot for 6 months.
on the hamstring and behind the knee, it's usually on the medial side, but
Feel the scar here. Okay. Is it too much? Okay. So when you have scar tissue that should not be there, it's like you have a piece of rock that if it's too thick, it could compress on nerve, artery, or it's also limited the range of motion, so it could cause a lot of symptoms. Is that too much?
No, that's fine.
Okay.
Got diagnosed with a form of Guillain-Barré and dystonia and
Really?
torticollis. Yeah.
Are you serious?
Yeah.
Did
I've
you
been to
have
Mayo Clinic. I've been everywhere, and I'm with you. I think it's all just compensation injuries.
Guillain-Barré? How did you come out with that?
Because when they put me in that boot, all these things started popping up, and I got extremely weak coming out of the boot, and they just could not understand why I was on a walker, and I'm like, I can't walk, you know.
Wow.
I have no idea why.
So they diagnose you with a lot of different diagnoses.
Yeah, a bunch of
Oh wow. Okay.
diagnoses don't mean anything there.
Well, it's basically labeling you, but is that gonna?
It does nothing but
Yeah.
say they put a name
Yeah.
on it.
We're gonna do the nutrition analysis to make sure you don't have any deficiency, that your body is healing fast. So I'm working on a superficial fascia now. You feel, so normal fascia movement should feel like this. You feel the mobility?
Yeah.
So I'm using ASTR tools to, this is a good fascia mobility actually. But here, you feel the tightness?
Yep.
So I'm gonna release it with the tool.
That's one of the areas that sort of hurts.
Is that painful when I'm doing it? It's okay.
No, that's good.
Okay, so so fascia is like well, the superficial layer is like a Spider-Man suit that wraps the entire body, very thin layer under the skin. So there's a layer wrapping a group of muscles and a layer wrapping each individual muscle and each individual fiber. When the fascia is tight, it's like you're wearing a t-shirt 2 to 3 size too small, and it feels like something cramming like this. So that's what I'm using to release the fascia layers. How's it feel?
That's right.
So medial too. You have issue here. I noticed like in your fifth toe, you really have a lot of worn out here.
Yeah.
Is that from your compensation?
I have no idea. I think I've always been that way.
Really?
Old
So-
shoes were always wore more on the outside.
So that's probably you put more of your weight on that spot. That's before this happened, is that correct?
Yeah, I think I've always been that way.
Okay. Well, we definitely need to work on your gait, but I cannot do that unless releasing the tightness, because if I give you feedback to correct your gait and you still have the tightness, you're not gonna be able to correct it. Does that make sense?
Yep.
Okay. And here on the left, what's going on? Where is the worst area?
It just comes and goes. If it comes, it's usually in that medial gastrocnemius. It get really tight.
Medial, okay.
Yep. And
Okay.
then
Medial gastric, it's the inner side of the calf, okay? Go ahead.
and then that anterior tib.
Anterior tib is the front of the tibia bone in here. Okay, what else?
But the only thing that's chronically there all the time is the hip flexor. On
So
the
I have
left side.
flexor on the left side, and then, okay, we're gonna get to that, but just let me focus on the lower extremity for now. So hip flexors on the right side, yeah? Have you had any surgeries or anything?
No, I've had 2 knee debridements on the right.
Why?
I don't know. Everything I've ever done, I've never got a clear answer from.
Okay.
I dislocated / I don't know, my knee when I was 17 years old playing volleyball. It came out of line and got
So
stuck there.
did they remove anything or just debridement?
debridement, and the second time they did it, they debrided, and I think they did
Oh.
take a little bit of the.
Meniscus?
I want to say they took a little. No, I think they just shaved the cartilage and reshaped it a little bit.
Sorry about that. Okay, so I'm working now on the scar tissue. Feel those bumps?
Yep.
That's all scar tissue. And you can see the map of the scar tissue here where there's a redness. And here. Feel that bump here? That's a big scar tissue here. Feel that?
Yep.
Normal muscle should feel like nice and smooth like here. But when you have those, so scar tissue, our muscle should act like a rubber band, contract and relax, stretch like this. So when you have a scar tissue, it's like you have a knotted rubber band. So when your muscle contract, does not really stretch much. And here we already know that, and when we saw that his range of motion for the ankle decreased significantly. I will not be surprised when I see all the scar tissue here, because the calf muscle attached from here all the way down, that calf muscle will not stretch. So it will limit the ankle range of motion. And you can feel here in the lateral peroneus, a lot of your scar tissue and lateral, your part of the calf, which means outside. You feel that one here? That's a deep end. Is that too much?
No, I'm good.
Okay. You feel how nice and smooth the medial side?
Yeah.
So your compensation more outward. Okay, and here the Achilles tendon, you see the medial lateral of your ankle. Okay. Do you have plantar fasciitis?
I don't know. I don't think I did. I think it's something with my big toe.
Okay, don't kick me, okay?
All right.
So you feel this grinding feeling?
Mhm.
That's a scar tissue here. I feel it here right in his plantar part of the foot. Okay? Sorry. Is it ticklish?
Yeah.
You see, it's fun to be here, you know? Too much? Okay. So I feel the grinding. I'm like actually feel like I'm going over like sand, but or small rocks right here. And Achilles, no, sorry, plantar fascia. Okay. And you see your hamstring. Let's pull this up. Sure, if I get lotion on your clothes. So your pain behind your knee and hamstring, proximal or distal hamstring?
I really
Medial?
don't. Yeah, it's mainly that medial attachment, and then
Okay.
somewhere right in here.
Okay. And you can see the scar tissue here in his IT band. Look at this. You see that redness? IT band and his hamstring. Look at that. Feel that?
Mhm.
Can you hear that? All this grinding? Is that too much?
No.
Yes?
No, that's fine.
Okay. Here, it's actually not too bad compared to,
Mhm.
that's very, it feels like washboard in here. Sorry. Okay. Here. And we really can map the scar tissue where the redness. Relax. Okay. Alright. So I'm not, you don't have pacemaker or seizures or anything like this.
Hmm.
So I'm actually not gonna use the Magna Heal for inflammation because I wanna rule out, are you primarily stuck in a proliferation stage, or are you going back and forth between inflammation and proliferation? Those are the stage of normal healing cycle. So proliferation stage means like you're stuck in a scar tissue, fascial restriction, muscle spasm. So we'll have you set up. Usually, like your gait usually slow, or since that happened, it's been slow. I know it's
Since
been
it happened, it's been
60
slow.
years, but before the 60 years, you usually fast walker.
Oh yeah.
Okay, if you don't feel pain, walk normal. How does it feel now from 0 to 10, and where do you feel it?
It's definitely better.
Okay. Is it gone or you still feel it? You can see the
I still
redness.
feel it.
You see his hamstring, you can see the scar tissue. Where do you feel it?
Feel it right through here.
How much from 0 to 10?
That's probably about a 4 right through there. And the other,
You're walking a little bit faster, actually.
other area I feel it is right in here.
So this spot and just 2 spots. Because
The
you
main areas,
you
yeah.
were complaining of 6 spots all over,
Yep.
yeah? So I just want to know the exact spot so we can work on it and we'll have you walk again. Just those 2 spots, the medial calf and the medial
Lateral.
ankle or lateral ankle.
Or the lateral, right in
Okay.
through here.
So let's have you lie in your stomach again.
Yeah, but it feels better. It's a little tight right in here.
I did not work on this with the scar tissue. Let
Yep.
me work on both of them and we'll have you walk. Let's see how they feel. So normally, relax. Your body go through this process. It could take like a few days or weeks, months or years for your body to break the scar tissue by itself. But when it lasts very long, like you're young, so my expectation for you, if everything is perfect, should be like 6 week max to really your body dissolve it. If that has not been dissolved, there's a couple of issues. Well, we need to have mechanical force with the tool to break it. That's one thing. The other thing is for the patient who has really very rough scar tissue, we know what the scar tissue consists of. So we're gonna do the laboratory testing after this or the nutrition analysis. But it's very common with patient that has high level of calcium and imbalance between calcium D and magnesium and K.
That is
That-
extremely tender in there.
Sorry, that too much?
No, I'm just saying that even a light touch in in that little area right
Tender.
there, it stays tender.
So I'm gonna have you walk again, and if you still feel some discomfort, I'm gonna jump to work on inflammation, okay? So if you have a balance between calcium, D, magnesium, and K, your scar tissue will be hard, will not be dissolved by itself. That's why we have to look at those levels to make sure that the calcium is not depositing in your soft tissue, and that's actually a red flag, because if your calcium does not deposit in the bone, it's going to deposit in the soft tissue, which include musculoskeletal system, the muscle, and the arteries and vein. That's cardiovascular disease. That's the plaque. So that's a red flag for me that if someone has a scar tissue for a very long time, that their body does not dissolve it, there's an imbalance here. With the tool, if that imbalance not too severe, we can get rid of the knot immediately. Some patients just a few seconds or a minute with the tools to get rid of it. But if it's too hard that requires several sessions, and you start with history like yours, I will be very anal about the ranges, because even the conventional range in the laboratory testing, they base it on a study 30 to 40 years ago that actually has not been updated, and the normal range actually should be smaller. So when you go get the lab work, they were like, oh, it's normal. No, that's not normal for you or optimal for you, for your condition, because you're building more excessive scar tissue. There is deposited in the right spot. And that's what we're going to look at. So let's have you walk and tell me how that feels. How's that? Any pain or it's gone?
It's definitely better.
Is it gone or you feel pain?
The only real tight spot I feel is right through there.
Okay, we want to distinguish between pain and tightness, because you're gonna continue feeling the tightness because you have a lot of scar tissue and that's gonna take a little bit time to shave it. My concern is now is the pain. The tightness that's gonna take a few treatment. My concern is the pain. But if you have tightness, I'm gonna use the Magna Heel to see if we can decrease that localized inflammation.
Just a slight bit of pain
Right in here.
right in there.
And
Feel the
everything else we
tightness.
worked on is
Feels
cleared.
feels
So let's
pretty
line
good.
your stomach. So I use the Magna Heel, it's a special magnet, and I coat it with anti-inflammatory coating to work on the inflammation. So I use it as a diagnostic and treatment tool. So if you have just mild inflammation here, with the Magna Heel should take like a few minutes to decrease the inflammation. If few minutes is not enough, that's mean you are having moderate to severe inflammation on that spot. That's why I did not use the Magna Heel initially, because I want to distinguish, are you stuck on this area in the proliferation stage or you have some inflammation? Does that make sense?
Yeah.
So am I on the right spot now?
Yeah, somewhere right in there.
It's all more lateral from the outside, yeah? Or do you
Yeah,
have
it's
a little
funny
bit?
because I felt like I always get more pain
Where?
on the medial,
When you walked today,
but when I walked today, it seems like as you loosened up the lateral, I'm more conscious of the lateral, and
yeah. Well, here's the thing. When we start to loosen up one area, your body gonna start to compare. And it's not like the pain traveling or the tightness traveling, but you have a kind of good baseline to compare to. So you're gonna complain, okay, it's tight here in a different area that was not, your body was not paying attention to it. Because there's nothing to compare with. You were comparing to the worst case scenario. Does that make sense?
Yeah.
How does feel here?
feels good.
So you said the lateral of the foot too? Lateral is mean the
Yeah.
outside. Yes?
Yeah, just right in there.
Right in here? Okay. How does this feel on the magnet?
Feels good.
If you don't feel pain, I want you to start to walk your normal speed. Okay? Because that's eventually what we need. What I notice is when you look down and walk. Okay? So just nice and tall and walk. How is that? Any tightness or pain?
Feels pretty good.
Okay, normal speed. Let's do that. Okay, couple of things. Normal gait, heel toe walking. So really land on your heel. Pick up this foot. As long as you don't feel pain, just do that. Suck your stomach in, nice and tall. So we're gonna practice normal gait after this. But I just want to make sure to challenge you a little bit to see how you respond. I will
Right
assume
up.
no.
But the only pain is right here in that big toe.
How much from 0 to 10?
Probably about a 3.
When you do the heel toe walking,
Yeah. When I try to push off a little bit harder.
because we try to train the new parent of normal walking. Both of them.
I think it's big toe on this one. I think it's the second toe on this foot.
Is it the toe or the metatarsals?
I think it's the metatarsal.
Metatarsals. Okay, so let's line stomach again. You see now, it's actually because we start to have normal gait, you start to notice the other tight area. It's not your pain traveling, it's just because you have not used this areas for a very long time, there's a lot of stiffness there. It's right in here? Yes?
Yeah.
Okay, so don't kick me, okay?
Alright. Do you know anybody that's close by that does a lot of gait training?
To be honest with you, you can do everything at home, even working on yourself. I have the online program for the foot that show you the proper gait training.
Okay.
It's a step by step and using the tools in case if you still have some scar tissue, we did not get rid of it in the 2 days you are here in California. That's what I usually discharge patient with. The toolkit and the online program that has a step-by-step to use the tools and the exercises, the gait, the anti-inflammatory diet, the behavior modification. We'll go over the proper shoes, the proper orthotic. So it's basically those programs, everything that I do with my patient for those conditions, except I'm not the one doing the manual stuff. The patients just have, you can do it on your own, and some areas in the back, your spouse can just do it. It's take 5-10 minutes a day to do it. Sit up for me, drink some water. But I'm gonna give you some feedback now. But in that video, I have a model. Usually, if you follow simple command, you do more complicated stuff as a dentist. So that program gonna be like just nothing, you know. But we really need to walk properly, sit properly, all of that. But I gotta go over the way you work here because that's not in a program. As a dentist, bending forward and stuff like this. So the stuff is not in the program, we'll go over it here. Normal speed. Acupuncture, you had boot, you had a lot of different modalities and treatment, and your background like a dentist. So what do you think about ASTR treatment? How do you feel with the treatment? Just working on it for like a few minutes today.
It definitely feels better, for sure.
So,
I mean, in the little bit of time that we spent on it, it definitely helped out a lot better than massage or anything like that.
have you had any treatment before that you experienced change like this in just a few
In
minutes?
just a few minutes.
Yeah. And that was 6 years ago. You had boot for 6 months. You had everything under there. Okay. So
Yeah.
awesome.
That's
I'm
good.
glad you're feeling better.